Good morning, everyone. I'm Michael McGinnis from the Institute of Medicine. It's my pleasure to thank each of you for joining us today and to welcome you on behalf of the Institute of Medicine and the National Academies. Welcome to our relatively recently renovated building here at the National Academy of Sciences. This is our sesquicentennial year, and the meeting that we're here to participate in today on observational studies in a learning health system is right in the wheelhouse of the reason that the academies were established in 1863. Essentially, the academies were formed to steward progress of science in the nation, and to do that by mobilizing the nation's scientific resources on behalf of the common good. And as we look at the dynamics in health and healthcare today, there is no more rapidly growing resource for scientific progress than that which is emerging from our clinical data infrastructure, building an entirely new form of public utility. And the question is how we best guide the evolution and application of that utility, how we can steward its progress as effectively, efficiently, and reliably as possible. So that's the purpose of this meeting, to chart the course for the use of this growing utility, and to identify the priorities that are necessary to guide its use and to grow its use in the most responsible fashion possible. The meeting is co-hosted by our colleagues from the Patient-Centered Outcomes Research Institute, PCORI, and you'll hear from Joe Selby in just a moment in that respect. We're very grateful for this partnership. On behalf of the Institute of Medicine side, the hosting element is the Roundtable on Value in Science-Driven Healthcare, and in particular, its Clinical Effectiveness Research Innovation Collaborative, which is co-chaired by the co-chair of the Planning Committee, Ralph Horowitz, and Rich Platt, who's also a member of the Planning Committee. And on the Planning Committee front, I'd like to point out that as most, indeed virtually all workshops under Academy rules, this meeting was planned by a formally appointed planning committee of the academies, and as I said, was co-chaired by Ralph Horowitz and Joe Selby. The members were Dr. Basu from the University of Washington, Dr. Brennan from CVS, Dr. Jacques from Centers for Medicare and Medicaid Services, Steve Goodman from Stanford, Jerry Kassir from the Tufts, Mike Lauer from NHLBI, David Madigan from Columbia, Sharon Lease Norman from Harvard, Rich Platt from Harvard Pilgrim Healthcare Institute, Bob Temple from the Food and Drug Administration, Bert Singer from the University of Florida, and Gene Slutsky from AHRQ, staffed very ably by the staff leader, Claudia Grossman, and the others who you will meet throughout the course of the day, including Liz Johnston, who's right here to my left, Barrett Zimmerman in the second row there. And I don't see Valerie and Julia in the room in the back there, but you'll certainly feel their presence as the meeting moves with great efficiency throughout the course of the proceedings. Please join me in thanking our planning committee for the great work that they've done. And in welcoming Joe Selby, our co-host.